Treating bone stress injuries is hard. Between countless books and thousands of studies, it can be challenging to figure out what information is helpful when you're working with living, breathing runners. All right, let's break them down. On December 4th, a brand new paper was published by the British Journal of Sports Medicine. This study aimed to come to an agreement on some fundamental principles in managing bone stress injuries. The researchers, along with clinicians and athletes across the world, came together to figure out what do we know about these injuries. You might even find a familiar name right there. We're going to break down the 8 key findings from this comprehensive paper to help you treat these injuries in 2025. Bone stress injuries arise from cumulative microdamage, occur on an injury continuum, and may result in a complete bone fracture. Bone stress injuries are on a spectrum ranging from a grade 1 stress reaction all the way to a complete fracture. Each patient is different depending on the specific injury, and if not caught early, a lower graded, less serious injury can progress to a full fracture. If you see a patient and you're suspicious of a bone stress injury, you have to catch it early so it doesn't progress to something worse. Number 2, we need appropriate terms. Often, the terms stress reaction and stress fracture are used interchangeably. Moving into 2025, we shouldn't be doing this. Most bone stress injuries are diagnosed via a MRI. When diagnosed, the radiology report will grade the injury from 1 to 5. Grade 1, grade 2, and grade 3 injuries are stress reactions. This means there's only swelling present. A grade 4 injury is when we can start to see a fracture line, and a grade 5 would be when there's a complete fracture. This table by Warden and colleagues provides some clarity. Understanding the severity of someone's injury helps you estimate the timeline for returning to sport. Higher graded injuries take longer, meaning that rehab is going to be longer and the timeline for them returning to running is also going to be longer. Understanding where an injury starts could be helpful in measuring progress. Injury location impacts management. You manage different bone stress injuries differently. This has been published in multiple papers where bone stress injuries will be categorized as low or high risk depending on their location. Some locations have a higher chance of healing on their own, while others are higher risk, meaning that there's a higher likelihood of complications or the need for surgery. When a runner is diagnosed with a bone stress injury, they might not know that there are different management strategies for different locations. There are certain risk factors for bone stress injuries. A history of a bone stress injury is the greatest risk factor for another bone stress injury. So a thorough past medical history is helpful if they've had bone stress injuries before. This could affect any other potential tests that we might need. We'll cover those in a second. But also how aggressive we want to be in that rehab plan if this is someone that's had multiple bone stress injuries. Lower bone mineral density is also a risk factor for a bone stress injury. Bone mineral density is the amount of bone tissue present in a specific area, and it's assessed via a DEXA scan. And there's lots of other risk factors. Genetics plays a big role in this, fueling, hormone function, and many other factors, which means you need to have a good analysis of this patient's situation, as well as a good team of other healthcare providers if you need to refer them to somebody else. Early diagnosis is important. Catching these injuries early is important because you don't want them to progress to a worse injury or a worst possible outcome. There's a particular pain pattern that I'm concerned of when someone enters the clinic. When a runner presents with a gradual onset of lower extremity pain that isn't present over a tendon and is worsening over time, I'm concerned of a bone stress injury. If a runner is presenting with a potential bone stress injury, it's a good idea to get imaging to rule that in or rule that out and figure out the right plan of attack. There are some clinical tests that could be important. The paper talked about how testing for vitamin D can be important, as well as screening for REDS and other nutritional interventions. REDS, or relative energy deficiency in sport, occurs when someone has low energy availability and starts to see changes in other bodily functions. A recent consensus paper from 2023 published this graphic that highlights how REDS and low energy availability can affect all systems of the body. If this is a new idea to you or you'd like some helpful ways to implement screening for this in practice, check out the description where I highlight this study. We don't have great guidelines for return to sport. Runners often feel a bit lost from diagnosis to returning to sport, so they just kind of spin their wheels. They might cross-train a little bit, but they really don't have a good path from diagnosis to getting back to running. Something that I tried to solve when I published my stress fracture protocols that give you the specific step-by-step approach. If you'd like to learn more about those, you can check out the description. I think it's very important that they're put on a progressive lower extremity resistance training program, they're progressed through cross-training, and that there's measurable tests along the way prior to them starting running. Again, I highlight those more in the protocols, check them out below. And lastly, there's a bunch of questionable stuff that we don't know anything about. New interventions get proposed all the time for these injuries and all injuries in general. So things like shockwave, orthobiologics, and ultrasound are often proposed or presented to athletes. I don't think we know much about these, and so I really question the use of them in clinical practice at this point. If someone has the money and they want to add these into their rehab plan, I think it's probably fine, but I don't think it should be a primary focus of someone's rehab. They need to spend much more time on a progressive exercise program and making sure that they're being screened for any of the other risk factors that can come into these injuries. Bone stress injuries are complicated. Hopefully this video and this study will help you with some helpful ideas to infuse in how you rehab runners. And if you find this content helpful, I'd really appreciate if you like the video and subscribe to my channel.